My name is Tori Shrock. I'm the Director of Organizational Excellence at Pella Regional Health Center, which is a 25-bed critical access hospital in Pella, Iowa. Healthcare is a huge industry. There are tons of products and services available. I know of several healthcare facilities that are still just using an Excel spreadsheet to track their complaints and grievances, which is not super secure. It also has limited visibility, and there's some problems with more than one person being in one spreadsheet at a time, those kinds of things. What we found with KaiNexus, we have the ability to have all of our users in the system at once. People can be looking at multiple cases at the same time. It doesn't require anyone to log out or log back in order for us to get in and work that. We also, because we're able to assign complaints and grievances to specific people, folks know what their next task is. There isn't a question of what's the recent update here, who's been working on this case, what's going on. It really allows us to say, okay, I've done my piece, now I'm handing this patient off to you, what's your piece, update the case, and go forward. And I think that's been super helpful for our organization for sure. We have 850 people in multiple different sites. We have 5 outlying clinics, as well as the main hospital facility. So we have quite a few different people in different parts of the region. So to be able to communicate within one software without having to have, file storage and sharing everywhere has been really a game changer for us. And I think when you look at the return on investment we're getting from what we're paying, it pays for itself time and time again.